let me know, put it in the chat or kind of holler. Okay, so my name is Livia Shriki. I kind of co-founded this company, Evidence-Based Practices of New England, with a colleague, Jamie Green. And our goal was really to kind of, I think we both have a passion for learning and teaching, and we wanted to help clinicians navigate kind of complex and difficult situations in treatment. I also have my own clinic, which is Boston Evidence Supported Treatments Practices in the Boston area. So a bit about me. So I have been doing DBT for several years now. I actually started out in the adult world and then got training in adolescents and families. And so it kind of felt natural for me to gravitate towards some of the parent work and the family work that included both the adults and the kids. And before we jump in, I really want to highlight Sherry Manning's book, because I reread it recently, and it's just really informed a lot of my work. I think she explains things in such a straightforward way, and it's aimed at the families of people with borderline personality disorder. But I think for clinicians, I really think it needs to be a required reading, because I actually think it really helps clinicians as well really understand how dialectical dilemmas for patients are so important in conceptualizing cases. All right, so most of you, I think, the prerequisite for this is to have some DBT training. So the beginning of this should not be new to people. But the idea here, right, the biosocial model that Marsha Linehan coined, right, is this idea that there is an invalidating environment. And that invalidating environment transacts with a biological predisposition of emotional vulnerability and emotion, which then results together in kind of like emotion dysregulation in multiple domains. And there's a kind of like cycle that happens where people feel emotionally dysregulated, vulnerable, and then feel very easily invalidated by their environment, which then fuels further dysregulation. Okay, and another way to think about this, or what this might lead to too, is this wavering of people between feeling underregulated and kind of like totally out there, and then feeling shame about that, or getting messages from the environment that that's not okay, and then swing into the other extreme of over-regulating and kind of shutting it all down, which is not really sustainable and inevitably leads to further underregulation. And this is vicious cycle that happens. And Marsha Linehan, right? Marsha talks about these 6 domains of dysregulation or overregulation, and ways to characterize behaviors that often occur in individuals with emotion dysregulation. Now, I know a lot of the talk around this usually is around borderline personality disorder. And I'm going to broaden that a little bit and kind of like address it in terms of emotion dysregulation or chronic emotion dysregulation overall, not only focused on BPD, just because I see a lot of people, a lot of teens, a lot of young adults, some meet criteria, some have features of BPD, and a lot of this can be applied to all of them, to most of them. Okay, and so the 6 domains are emotion or the 6 domains and 3 dialectical dilemmas. So the first dialectical dilemma is wavering between emotion vulnerability and self-invalidation. And we're going to go into what each of these, like a description of each of these in a minute. Active passivity and apparent competence, and then unrelenting crisis and inhibited grieving. Okay, and so I'm going to argue or kind of present the thesis basically that helping parents or caregivers identify where their kid is on an extreme of a dialectical dilemma in terms of their behavior, like what their behavior matches, and then identify how they might be reinforcing one of the extremes, can then help kind of lead them to figuring out what a more effective response might be. And I think this is like a simple way to really clarify a lot of the chaos that happens that we see in a lot of these families.
Okay.
So I'm going to just use two examples and walk through the different examples. If you could mute your mics if you're not muted, that would be awesome. And if you have a question, of course, feel free to unmute and interrupt me. All right, so family one, Alex, 15-year-old white cisgender heterosexual young man, goes by he, him, his pronouns. He has severe social anxiety to the extent that he's beginning to refuse school. And often at home, his parents don't see him, and he's in his room with the door closed playing video games. In general, though, he's a pretty compliant kid, unless his anxiety is really vamped up. He kind of follows rules. I've met him. He's a nice kid. Parents are married. Both work. Mom struggles with a good amount of anxiety. And dad is kind of like pretty level-headed, I would say, and I would say a pretty big problem solver. So he's very logical, tries to solve the problems. The parents present as pretty distressed by any showing of distress in their kid. And when he gets upset and angry or sad or anxious, the parents kind of present with this narrative of like, we messed up and we are bad parents. And therefore our kid is suffering. And this ultimately leads them to having a very hard time setting limits consistently, and also to some burnout. And ultimately, it actually makes it hard for them to validate their kids at times, which is kind of that interesting dichotomy that happens, right? The other family is a family of Kelly, who is a 21-year-old college student. She's an Asian American, lesbian and gay female, goes by she, her, hers pronouns. She's straight A student, really high achieving, like highly regarded college, often very compliant with rules. She's actually an RA and she helps other kids, other college students manage their own issues. And she's often talks about how she's the therapist of a lot of her friends. She has a pretty solid support network, even though she has just likes a lot of people with emotion dysregulation and struggles with that fear that her friends will reject her. She has an eating disorder, which, there's a lot of restricting and also some purging. She's a pretty perfectionistic person and really expects a lot of herself. She has a history of self-harm and pretty severe and chronic suicidal ideation. Her parents are immigrants from China. Dad is pretty anxious and avoidant, sometimes kind of presents with paranoid ideation, and mom is pretty authoritarian. She's the problem solver. She runs the family business. And she, at least from my perspective, can be a pretty rigid thinker. So the thinking gets very black and white very quickly. Both parents have very high expectations of their children. Emotions are not openly expressed in the family or discussed in the household. And it kind of feels like, the parents describe that everything seems okay until they get a call from, historically in high school as teachers. Now, like teachers would call and say your kid is suicidal, or recently they've been getting bills from therapists that they didn't know their kid was seeing, and even a partial hospital program that they didn't know their kid was attending. And they get very confused and frustrated. And when they see her, she's like fully functional, she's happy, she's a good student, she's friends. And then they get these messages from other people, other adults in her life, that things are not okay. So I'm not going to actually draw too much on this constellation of dialectical dilemmas, but from the DBTA manual. But, I think it does help in terms of kind of like mapping out the family dynamics that happen. And so you can see that Alex's family, they're kind of like more on the loose side. So for example, they have a really hard time, like he is on the computer all the time. They have a very hard time getting him off the computer, setting limits around that. They do a lot of problem solving for him and do a good amount of fragilizing him. And interestingly, even though they're very distressed by his distress, at least one of the parents went in the room with me, often kind of like seems okay with a lot of the behaviors and kind of says, it'll be okay, we'll figure it out, and has a hard time really grasping the severity of things. Now, the other side, like Kelly's family, right, have a hard time actually showing much warmth. And so there's a lot of strict enforcement of rules, a lot of forcing independence, so very hard time helping their kid kind of gradually become independent. If you could make sure to mute your mic, that would be really helpful. Okay, now interestingly, they actually make some light of problem behavior. So I wouldn't say that they make too much of typical adolescent behavior, but for example, I think the kid has learned a lot of the eating behaviors from parents. And so they really underplay some of the struggles that their kid has. So what I'll do is I'll walk through each of the dialectical dilemma extremes and we can apply it to each kid, okay? So, and each family. So emotional vulnerability, right? So the way that's described, generally speaking, is that the person is easily activated, emotions activate high quickly, and there's a pretty slow return to baseline. Just 1 second. Angela, could you please mute your mic? Can't see who it is. All right, thanks. Okay. So again, easily activated emotions, they rise really high and they take a while to get back to baseline. And that causes a really difficult situation for the person, and they kind of feel like they're at the mercy of their emotions, they're out of control. And what you'll also see is a lot of times there's secondary anger. So maybe primary to the anger, there might be shame, there might be sadness, there might be fear. But often what you see on the surface is a lot of anger. And so what I'll tell parents is the clue that this is what's going on is you might see your kid feeling pretty helpless in the face of feeling overwhelmed. And they might be doing kind of this blame game where they're blaming you. Okay, so they're not blaming themselves, but they're blaming the external environment. And some things you might hear them say is, I can't help it. This is just who I am. I'm out of, I just can't control it. It's just who I am, right? And things like, it's all your fault that I'm dealing with this. Okay, so I can't control it and it's your fault. So in the case of Alex, all right, often what we see, especially when parents do set a limit, is this helpless behavior, kind of like expression of emotion, very distressed and a lot of anger. You're taking away the only thing that soothes me, and it's all your fault that I'm anxious. This is all your fault that this is happening to me. Now, what parents usually do in response is, rather than disengage, rather than calmly be consistent, they have a really hard time doing that. And they start feeling a huge amount of shame that they feel like they are causing this to their child. And they start feeling like they've screwed up and this poor kid, and what are we making him deal with? Right. And you can see that actually might reinforce the kid's perception too, that, they can't control this. And it really is because of my parents. You might also say, and we'll talk about this in a bit, that it reinforces a good amount of self-invalidation. Because if you're a kid who's very sensitive and then you see that your behavior leads your parents to kind of double down in shame, you're likely going to feel a good amount of shame yourself. All right. Kelly, on the other hand, talks about how her anxiety and distress feels very physical, and it just feels like too much. It like literally feels like physical pain when she's feeling sad or anxious. Her parents have a really hard time understanding that, and they'll tell her to basically shut it down. So just stop it. You're fine. I don't know what your problem is. Okay. Again, you can see how that might lead to both reinforcing this feeling of helplessness, because she does feel helpless, right? And she can't just shut it down, and she doesn't know what to do about it. And we'll see in a second, right? It can also fuel that self-invalidation, right? So the way self-invalidation is expressed is kind of like the person is oversimplifying how easy it is to solve these problems. So on the one hand, they feel out of control. And then on the other hand, well, if only I did this, everything would be fine, right? This might also lead to a good amount of unrealistic high expectations. So if I only got straight A's, nothing would be wrong and I'd be okay. And that's all I have to do. And if I got straight A's, I wouldn't be dysregulated. I wouldn't have to deal with that part of myself, right? So it's kind of shutting down that temperamental predisposition that they can't really control, and kind of like maybe putting it in denial and putting it on the shelf if only they did certain behaviors a good enough way. And what comes with that, right, that's a symptom, I think, too, of a lot of shame. They have a lot of shame that they can't control these emotions, that they're so sensitive, that other people around them don't seem to be struggling with emotions the way they are. And so what's wrong with them? Okay. And then they go to this place of like, I suck, I'm crazy, and a lot of beating up on yourself. And so I tell parents, one clue, right, that your kid is engaging in self-invalidation is either they seem to kind of really be engaged in this idea that if only they did everything perfectly or good enough, everything would be fine, or they're right, they're really doubling up on themselves with shame, doubling down on themselves with shame. And so with Alex, what you see is while he's angry at his parents, he's also really angry at himself, and he's really upset with himself that he can't just get himself to school. Right. And he sees the pain he's causing his parents, so to speak. At least that's how he sees it. And it feels like, well, he's a piece of crap. He should just be able to suck it up. Right. Now, the parents see him getting so, frustrated with himself, and they try to reassure him. They try to soothe him. No, you're not a piece of shit. You're awesome. You're great. You just got to do this one little thing. You just got to do this. Just try to do this. And so a lot of like nudging and kind of trying to edge him forward in a bit of a like pushy way, which, ultimately does reinforce this feeling of like, well, if I can't just do it, then what's wrong with me? Right. And that kind of cycle gets reinforced. And of course, there's a bunch of arrows here with the idea that this all is a cycle that fuels each other, right? And so the kid, it's important to also like remind parents that there's a pendulum here where the kid might swing between blaming themselves and blaming you, right? Feeling out of control, feeling they just need to like shut it down. And it can be really confusing to parents to see that, and very hard to find the ability to validate the kid in the midst of that. But this helps them kind of map it out a bit, right? Sorry. So for Kelly, right? So what she'll say with self-invalidation is, she oversimplifies things. So I just need to not eat. Like if I just didn't eat, everything would be okay. If I just got straight A's, I'd be fine. And in the moment when she's in emotion mind, she truly believes this. And then, of course, inevitably, it gets to a place where you can't not eat. She might get an A-. She might have a hard time with an assignment. And then it swings to this self-hatred of like, I'm terrible. Why can't I just do this? Her parents, when she does have unrealistic goals for himself, actually show pride in that. So they there's a value for them in perfectionism, I think, to some degree, or they struggle themselves with this. And so they actually internally feel kind of a sense of pride when she tries to strive for these unrealistic goals. They have a hard time with the idea of shaping as well. And the other thing they do is when she is expressing shame is I don't know if you guys have experienced this with parents, well, they'll go to the other extreme and say, well, you're beautiful, you're brilliant, you're a genius. And they're intending on validating or giving their kid like reinforcement here. However, the kid then is in this other dilemma of like, well, if I'm not brilliant, then what am I? Well, I suck, right? There's no room for that in between. And so that inevitably, again, reinforces that cycle, and reinforces dysregulation and overwhelm and so on. Okay. Now, active passivity, right? So it's this idea of like the person is acting in a way that gets people to elicit help. Sorry, this is extra slide there. To elicit help. However, they're not actively asking for help. So I think Kelly Kerner talks in her book about kind of the classic example is usually a female, right? But I think this would apply probably to any person on the side of a road with a flat tire. And rather than calling AAA or flagging someone down, they're kicking the tire, they're crying, they're curled up in a ball on the ground. And inevitably, people are going to stop, pull over and help, right? Because I mean, someone's going to do that. They're likely a couple people at least will do that if they see that. But this person didn't actually actively engage in the solving of the problem. Okay. And so I try to express to parents like the sign that your kid might be engaged in some active passivity is that you might notice inside, I have the urge to help. But then you notice they didn't actually ask for help, or you find that the way they're asking for help is kind of eliciting this feeling of like, I don't want to help them. Like, I don't know what they want from me, and kind of like almost kind of revulsion and pulling back. So for Alex, what happens for him is that he curls up in a ball on the floor and panics. And acknowledges like, I just need to go to school. I just need to go to school. But he's also not really engaging with his parents in that moment. And the parents in turn are trying to probe him, to nag him, to suggest things, to help him feel better. And this, of course, just kind of like increases his passivity. Now, the other thing really important here is problem solving. So Alex does not talk to his parents much, does not engage in conversation even between, like, so you might say this might be some emotion vulnerability here, right? But in between these crises, also, he's not engaging with parents in problem solving and in collaboration. And so what parents end up doing is they do, like, especially dad, he's like, okay, time to problem solve, time to figure it out. I'm going to call this person and that person. I'm going to suggest this and this. I'm going to do this and this. Dad's running around in circles trying to problem solve. And the kid is pretty passive. Okay. Now, the reason this reinforces active passivity is that the parents are really not giving the kid much opportunity to both like kind of have the consequences of being passive and actually learning skills to solve the problem, right? And so in a way, the parents, I think, are feeling like they're helping their kid in the moment, they're helping him with the problem, yet they're actually reinforcing the chance that in the future, he will continue to act passively. Okay. Now, Kelly, on the other hand, some of them, there's some similarities where she kind of like becomes very quiet, and instead of talking loudly, she's whispering, and she maybe like lies down on the couch or curls up into a ball. The other thing she does is she tells her mother, well, my therapist is making me do this. And I do think that's an element of active passivity there, because she's acknowledging something's going on, something's up, but it's not her choice to solve the problem. It's her therapist that says there's a problem that needs solving, and she's just doing what she's told, right? And there is a passivity in that, even though to some degree there's some activeness as well. And then the parents get very frustrated by this, and mom often tells her, well, you should trust me, not other people. Why are you just trusting your therapist? Okay, which again robs Kelly from the possibility of owning it, right? Mom is not curious with her about what she thinks is important. And then Kelly doesn't get to tap into her own wise mind and is constantly looking to others, and herself, pretty passive. Okay. Now, apparent competence is pretty scary, right? So it's this idea, right, that people are competent in some contexts, but not in others. So one example might be Like, you know, I have a kid in treatment right now who can recite all, and actually Kelly here is really, she's been through DBT and she can recite all the skills like that. You give her a pop quiz, she'd get 100% on it. However, when emotion mind strikes, there's this like deer in the headlights, hard time accessing skills. Right? The other way this might be expressed is that the insides don't match the outside, right? So the person's internal experience or visceral experience might not be showing on the outside. And it's not necessarily that they're suppressing their expression, right? But it's just that there's a mismatch. And so the environment, you know, people are more wired to read nonverbal cues than verbal cues. And so if someone tells you, I'm really sad right now, you're more likely as a human being to trust the nonverbal communication and the shrug and the nonchalance than actually think something's really wrong. And then what happens, right, is the person doesn't feel heard or they don't get the help that they need and a crisis ensues, right? So a clue to this that I tell parents is, you know, is your kid, do they seem kind of overly confident in their ability to do something that you're not as confident as them? Are they saying things that don't match what they're looking like? And if you notice that things shift from context to context, that of course, that's another clue, right? If you're surprised that your kid fell apart when a second ago, or maybe an hour ago, they were okay, that's a good clue that they're not pulling your leg. They're not trying to trick you, but they might have skills that they can apply in certain contexts, but they're not generalizing to other contexts. All right, there's a mistake in the slides. All right. So for Alex, right? So we talked about the active passivity. For Alex, at home, he's pretty talkative. When you talk to him about one of his video games, he's like Minecraft, he's talkative. He'll get a really good conversation going when he's home with friends. So they came over for his birthday and they were at their house. For the most part, he was very social and happy. However, as soon as Monday morning hit or the talk of school came up, he becomes panicky and withdraws, right? So he has some level of skills. He's a smart kid. He can be very, you know, when you talk programming with him and strategies around gaming, he's very bright and he has a lot of skills in his pocket. But when emotions get high, that's when things fail. And the parents kind of get confused, right? So they say, you know, he seems fine. Why can't you just do this, right? So just go to school. You were hanging out with your friends yesterday. Why don't you just get up and go to school, right? Which ultimately doesn't teach him to become more competent in those moments, right? Because they're kind of oversimplifying things. And then he's not gaining, he's not able to put into words what's going on for him. He's not gaining many skills, right? And again, these swing from side to side. So apparent competence and active passivity, he's going to feel pretty overwhelmed and helpless, and it's going to be hard to feel like he can be active and engage in the problem solving process. Okay, Kelly, on the other hand, right, we talked about this, how she's a straight A student, everything is fine, and then her parents aren't in the picture, she's at school, and they find out she's suicidal and needs hospitalization. And they have this like, what the hell is going on reaction. They also have, you know, this reaction of like, but you're getting really good grades at school and you're doing so well at your job. So like, clearly when you try hard enough, you can do it. So, you know, this is a message of like, you just have to try hard enough. And that's what the kid hears. And again, Kelly isn't learning skills to manage to generalize her skills to other contexts. She's only learning, I just need this oversimplification of the picture. I just need to try harder. Okay. And again, that vicious cycle continues. So the final dialectical dilemma is unrelenting crisis and inhibited grieving. Okay, so unrelenting crisis is what we often see in some of our patients, where there seems to be a crisis after crisis after crisis. And something that might contribute to this is this idea, is that high reactivity and slow return to baseline. Because if someone who's very emotionally sensitive encounters kind of a normal stressor, so to speak, and has a really high intense reaction, and it takes them a while to get back to baseline, whenever another hiccup happens in their day, they're already activated, and it just kind of builds on that. And it's very hard to keep tuned into wise mind and make, an opposite action when you're getting more and more activated, right? And so that leads to more and more crises. Add on to that there's comorbid psychiatric and physiological conditions that come with severe and chronic emotion dysregulation. It's just hard to manage things that come up in life, let alone things that would be traumatic or crises for any of us, right? And the clue to the parents is that the parents is exhausted from putting out these fires with their kid, right? So the Sylvester should be Alex. I was toying with New Year, different names for people, and forgot to correct it back. So names related to the new year. But anyway, so ignore that. It says Alex. So Alex is falling behind in high school. He's failing classes. He's, some of his friends aren't coming around as much as he isolates more and more, or saying they don't really feel like hanging out with him. And he's getting more and more kind of deflated and emotion minded. And it feels, and every time something like this happens, he gets very upset and very overwhelmed. Now the parents' responses are that they again, these are the parents that feel very terribly for him, and they really try to rearrange the world in a way that soothes their kid. The other side of this is they often assert control, right? And so they're calling teachers, they're writing emails to therapists about their kids' behaviors and all the crises that are happening. And they're trying to make sure everyone is doing things to accommodate their kids so that their kid stops with all these crises, right? Again, that doesn't really teach Alex, not Sylvester, Alex, to manage things. It doesn't teach him to figure out what to do with these crises that come up, and how to maybe learn from them even, because they're kind of like moving all the variables around him to accommodate. All right, Kelly, her unrelenting crises is that she's constantly, not constantly, but often struggling. Her parents don't know this, and she gets referred to higher levels of care. So she kind of talks about how it is, it's okay if I'm in once a week therapy, like that's normal, and her parents are like okay with that. But as soon as it becomes more than that, which is totally understandable, they get concerned. And the way she struggles to manage things often lead to those referrals, right? And the way the parents respond to those crises when they come up is actually, so on the one hand, they're very confused, and there's that what the heck kind of reaction. There's also, though, before that, very briefly, or when they're sitting with the therapist and Kelly in the room, a good amount of compassion that comes out. Right. So, oh my goodness, I didn't know she was struggling. And there's always the question of like, well, is she suicidal? And there's a sense of like, if that was the case, then their agenda. Sorry, does someone have a question? There's this idea that if suicide were on the table, their agenda would kind of get dropped, right? And so that really does reinforce some of that crisis behavior. If you get validation for crisis-based behavior, then that's going to get reinforced, even if you don't like it and you don't want it to be that way. Okay, inhibited grieving is that suppression of emotion, right? So patients saying they just don't do sad, or they have a hard time, learning to put words on their emotions and articulate and process them. So they have a hard time tolerating the emotion, fully processing the emotion, and the emotion is so intense that they push it down. Okay, and the clues that I tell parents to pay attention to are, sometimes parents will be like, it just feels weird. Like she's so calm. Like what? She was really upset like just half an hour ago. And now she's just kind of like hanging out in her room and seems totally calm, and it feels really weird. Um, or, something happens and you would expect someone to be really distressed and they seem totally cool and they're saying they're cool. So it's not so much that discrepancy, but more like it's odd that they feel okay. There's this kind of like your hair stands on the back of your neck a little because it just doesn't match the situation. Right. So Alex is engaging in constant video gaming. It's his way of avoiding emotions, right? So like if he's playing a video game, he doesn't have to think about school. He doesn't have to think about homework. He doesn't have to think about his social anxiety. And honestly, the parents kind of feel a sense of relief when that happens. On the one hand, they're distressed when it's hours and hours of this. But after trying to set a limit and getting a lot of pushback, they also feel this sense of like, well, maybe we just need to let him be. Like, at least he's feeling good right now, right? Which obviously reinforces that avoidance. Okay. Kelly does this interesting thing where she can be super upset, and it's kind of like she goes unseen. Like all of a sudden she can go like this, and her appearance will totally shift, and she's calm and collected. And it's a little bizarre to witness, honestly. It's very hair-raising. And she'll be like, okay, it's okay now. And it's a response she's clearly learned over her lifetime. Like she needs to learn to shut it down. And it makes sense because what the parents' response to that in the room is they believe it, right? And this is her report. And they kind of say, oh, like when she's calm, like that's my kid. That makes sense to them. And it also makes sense in the family culture. We'll talk about it in a little bit, which is like that you don't express a lot of emotions, and actually being calm and collected, even in the midst of chaos, is kind of normative to them. And so they're okay with that, and they reinforce it, which ultimately doesn't help Kelly really process her emotions and deal with stuff, which ultimately leads to higher SI or urges to self-harm or urges to engage in eating disorder behavior, which then leads to more crisis and referrals to higher level of care and so on. Before I go on, any questions? You can feel free to type them in the chat or holler. Okay. Right. So the steps that I would suggest and I try to take with parents is first try to identify. So your kid is acting a certain way. Like first take a step back. So maybe the stop skill. Okay. And try to identify what's the dialectical dilemma extreme. Like where are they on the extremes of the dialectical dilemmas? And what might be the function of that behavior? And what is your automatic kind of like knee-jerk response? Like what's your urge basically to do there? Notice that urge and try to ask yourself, how is this, what's the message that I'm giving? Is it going to reinforce things or reinforce what I wanted to reinforce basically? And then what might be a more effective response? Okay. So with emotion, so I'm going to draw a lot on Sherry Manning's book here. And then you'll notice that there's a lot of bullet points here, and we can kind of boil it down from a clinical kind of lingo, right? So she's speaking to parents directly, and this is something to talk about with parents, but in your clinical mind, you want to really also kind of boil it down to some core principles that you're not going to be very surprised by, right? So you want to, suggest to parents to take a moment to self-regulate. So if the emotion vulnerability is going on, the kid is really overwhelmed, you want to really try to kind of take a breath, try not to be reactive from your own emotion mind, try not to just change things, right? Be sincere, ask what they need, be curious, find something to validate. So you're starting to see that a lot of this is kind of like the different levels of validation, right? So some curious questioning to try to really understand the situation, and then in helping parents walk through some of those levels of validation, right? And then some teaching of skills, right? So especially if the kid isn't active in treatment, you can, I think, and it is important as a parent to try to teach your kids some of these skills that you're hoping that they will draw on, right? So kind of opposite action it a little bit and project confidence and feel confident, act confident even if you don't feel it. Suggest a way that might engage in some opposite action, right? And always come back to validation, right? And you might, and we'll talk about this in a little bit, but you might kind of like give some psychoed to parents that when you're calm and when you're validating, the kid is also going to get regulated by your self-regulation, right? So it's a two-way street, and regulating yourself and providing that validation can be really helpful. I have a question in the chat. Validate not being in control. Yeah, right. So the validation, and there's a question about whether you'll get slides after and what exactly you're validating. So yes, I'm happy to share the slides. You're validating the idea that it is horrible that they do feel out of control, and that it's really sucks that it feels out of control, right? And you might also kind of correct a bit and say, this doesn't mean there's something wrong with you. It's just that you're feeling so crappy right now, and that really sucks, right? And so you do want to validate that experience of feeling out of control, right? Now, it's important, though, to remind parents, really important, that this doesn't mean that there can't be any limit setting or they can't observe their own limits, okay? So sometimes when you talk about validating, and to certain parents, for example, Alex's parents, right? They might err on the side of, okay, then we need to like really give in to everything again, because they're so vulnerable. And that's how we're going to validate. And in effect, like that kind of doesn't really validate, because it also sends the message of you can't deal with this, as opposed to how can we help you deal with this a little bit at a time. Okay. With self-invalidation, again, there's common denominators here, right? So validate the experience. So you don't want to validate the invalid. So if a kid's saying, well, I just suck, you don't want to say, yeah, I mean, it sounds like you suck. That makes sense. That's not gonna be super helpful. And it probably doesn't really match the facts, right? But you can say something to the effect of, like, it sounds like you have that feeling that you suck, and that sucks, right? You can try to offer some problem solving. And again, remember that with self-invalidation, the person is really oversimplifying how things can be solved, and you want to really model shaping, and you want to teach parents to do that too. So it's really important that your kid learn those small steps towards the overall goals, and help the parents, learn about shaping and how can they do that with their kid, right? And always come back, you kind of like lead with validation and with validation. I see a hand raised.
Hi. Yes, thank you. Just a quick question. So in thinking about a crisis situation where Johnny doesn't want to go to school sucks, and we're staying in bed, and mom is getting upset about that, trying to engage him. He is becoming aggressive, things like that. And mom wants him to go to school, right? And in trying to help mom to de-escalate and problem solve that situation, my question is, would it be helpful and beneficial to sort of get mom to change her idea of the goal, which in her mind in that moment, her goal is to get Johnny to school, not to de-escalate? Does that make sense?
Yeah.
Yeah.
Yeah. And I think often school refusal honestly is kind of its own animal, and it's so hard to treat, right? So just to validate. And part of that is because, there is this urgency that the kid attends school, and at the same time, that might not be in the card today, right? And sometimes you might need to also kind of help the parents see how shaping is okay. And it might be in this moment that you need, that the goal is to help the kid articulate what's going on for them, and for you to understand what's going on for them and help them put words on it. And maybe that's the task of the day, as opposed to them getting out the door into school.
Okay, makes
right.
sense. Yep.
And, I had a supervisor who talked about how that's often an exposure for kind of the entire system. It's the exposure for the parents, it's an exposure for the school, because there's a lot of different variables that are putting a lot of pressure down. And at the same time, the other side of the dialectic is you're not going to get there without that little bits of progress at a time.
Exactly. Thank you so much, Doctor. Makes sense. Thank you.
Yeah, sure. So with active passivity, you want to kind of like help hang on one second. Just want to make sure you're like, sorry. Okay, so I think we were on self-invalidation, right? So we were wrapping up this slide. So you want to return to validation. So lead with it, come back to it. And then with the self-invalidate, the invalidation part, you might want to explore a bit, like, and help the kid or the person, like, check the facts. Okay, so like what happened? Like, maybe there's a reason they feel a lot of shame. Maybe there's some grain of truth in the shame. It probably doesn't match the intensity of the shame that they're feeling. But if you like yelled at your teacher to F off, like, it makes sense that you would want to try to figure out how to not do that again next time. Doesn't mean you're a monster. It means that your emotions got the better of you, and we need to figure that out, right? And in that sense, you're really working hard to help the kid ride the wave of shame, right? And deal with the shame in a way that's useful, and kind of shed the part that's not useful. The other part that Dr. Manning really talks about in her book, which I think is really hard for parents, for any parent, it's hard to guide parents in this, but it's also really important, is to remind the parents that a lot of like the intensity and the role of shame here, and how can the parents kind of intervene to help the kid not just hide, but actually explore and ride this wave. And so some clues she talks about is, if the person you're talking to is like looking away, looking down, gets quiet, try to keep talking with them, not reinforcing the quiet and withdrawal. Try to keep eye contact going, even if that intensity rises. And then when it goes down and the kid seems like more regulated, then you can kind of back off and in a way reinforcing that they rode that wave. Okay. With active passivity, you're wanting the parent to, and Dr. Manning talks about this as well, very eloquently in her book, to really kind of like check in on a few different points. So why is this happening? Okay, so why is this person in front of you, your child, or the kid you're taking care of, they're acting really distressed and they're not engaging in problem solving? Is it because they can't, like they don't know what to do? Is it because they normally know what to do and there's some apparent competence here, but their emotions are interfering, right? Is it that they know what to do, they can do it, but they lack the confidence to actually like make themselves do that opposite action and go for it? Or is it that, on some level, you just don't want, like the way they're asking for it, that demanding is like not what you want to deal with. Maybe they're demanding, or maybe they are acting so passively that you're kind of burnt out, like you're tired of being the person that constantly is solving things, right? So really important, and for this is true of parent competence as well, is to be clear and kind of like get a sense of like what the problem is in the first place. So like what are we dealing with here? What needs to happen? Right? So kind of like trying to drag some facts out of the kid in front of you who's overwhelmed. And maybe ask questions about emotions that might be interfering. So are you scared about this not going your way? Are you pissed off that you have to even deal with this? Do you feel embarrassed about it? Do you feel like you can do it? Or do you feel like, oh, I'm just too, like, I just don't feel like I can, like this confidence thing. And if it is number 4, Dr. Manning encourages people to use the dear part and kind of, so you're asking me this question, or you're not asking me, but you look really distressed right now. You're demanding that I do something for you. I'm feeling kind of uncomfortable just doing that. And I really want you to use different words to ask me what you want. And if you do that, like, I'd be willing to do this with you, right? So you want to be really careful of like, make sure that the parents are understanding that them solving the problem for the kid is not making things better, even if in the moment it feels good. And you want to really drive home, you can solve it with them, you can role play with them, you can help them fill out forms, you can help them navigate a system, but don't do it for them. Okay. And you might also, again, so this is that kind of like balance between validation, curiosity, and also maybe teaching the kids some skills here. Can you walk them through some problem solving steps in order to figure out what they need to do next? And by maybe doing that with them, you're also modeling it for them and teaching them that skill. Okay. When kids are apparently competent and parents are confused, first of all, you might want to validate the parents. This is really confusing, and it might be really scary too. So when you see that your kid seems to be fluctuating from being able to do things to all of a sudden falling apart, take a moment for yourself. And remind yourself that this is a sign that maybe the skills didn't like generalize, right? So remind yourself why this might be happening, and then provide some validation. So, just an hour ago you were so calm and now you're so distressed. Like, that must be really confusing and kind of maybe even scary for you too. I know I feel confused and scared, right? What's going on? Like, what do you think changed between then and now, right? So like, what do you think is going on that at home you seem so happy, but then when you're in college, I'm getting calls from therapists that you're suicidal, or in high school, I should say. And then, what do you want me to do here? Like, what's my role? Now, this might be a little different depending, again, if the kid is committed to treatment and in treatment versus not. And I think that's a line that's really hard for a lot of parents, and a lot of, when you're guiding parents, that's very difficult, because if you're working with a team and the kid is brought into treatment, has a good alliance with a therapist, then you can really work with a therapist on having that safety net in the background, right? But when the parents are flying solo on their own, you do have to be a bit more, you have to assess more and be a little more prudent in your responses to them. And there might be more onus on the parents to try and teach the kid skills. And so depending on the age of the kid, the parents might feel more or less comfortable taking different roles here, right? So with a college student who's in their 20s, it might be up to her really what she's willing to let her parents do for her. However, if it's a high school student, ultimately it's up to the kid anyway, but the parents might decide to be a bit more active, right? And most importantly here is really balancing kind of unrealistic expectations without fragilizing. So what do you think your kid can do here? What's a bit more than what they can do, and how can you reinforce them towards that goal, right? Now, if there's that discrepancy between inside and outside, pay close attention to the words and be really curious. So you're saying you're sad, you don't look sad. So like, what's up? That makes me like a little worried about you, because or I feel okay, but I want to make sure I'm checking in with you, that I'm not making an assumption that you're okay when you feel really, really terrible inside. And so that direct communication is super important. Okay. With unrelenting crisis, again, it's really easy and understandably so for parents to go to this place where they're blaming the kid. Why does all this, why do you keep having all these fires happen? Just cut it out. That can be a pretty understandable knee-jerk reaction. So parents have to kind of very kind of like effortfully remind themselves, okay, it's not black and white. There's different variables here. There might be other stuff going on that we don't know yet. So you know, Dr. Manning will really encourage parents to suggest if the kid isn't getting help already, that they get help. There's also something really important here about self-care, right? So if your child, especially, well, I mean, any child at any age really, if there's crisis after crisis after crisis, in order to be able to be centered and help your kid make contact with their wise mind, it's really important that you are as close to your own wise mind as possible. And the only way I know, and it seems like most treatments know for people to do that, is to take care of yourself. And it's really hard for parents sometimes to allow themselves to take care of themselves when their kid is suffering so much. And draw on whatever metaphors you can, like, on the plane, when you put your own mask on before you put it on your kid, whatever works, but really come back to, like, how are you taking care of yourself? Did you exercise today? Did you eat today? Did you sleep last night? Because parents will, like, well, my kid is suffering, who cares about me? Which is understandable. I can totally imagine feeling that way. And I would need to be reminded that that's important, to take care of myself. And then the skills part of parents teaching skills is maybe teach your kid this idea of wise mind if they're not in DBT. What is your, if you take some breaths and you tune into yourself, is there something here that feels more right than others? Can we do some pros and cons, like the DBT pros and cons with the 4 quadrants that kind of help you zone into, what's wisdom telling you here? And if you're too overwhelmed, what are some distress tolerance you can teach your kids? Okay. Inhibited grieving is hard because I think often kids really learn this from their parents. And so you might really be trying to model and help the parents be open of their own emotions and expressive in order for them to then encourage their kids to do so. So you want to be kind of mindful of what the parents are modeling to their kids. Help them validate their kids that emotion is okay. It's okay to talk about what's going on. And because these kids are like often inhibiting emotions pretty frequently when they're feeling things intensely, they might have a hard time knowing how to put things into words, right? And one of the first things you teach in CBT is like emotions, thoughts, urges, physiology, right? How do you put your experience into words? And parents might need to start helping and teaching their kids to do that in a very kind of concrete way. Something that DBT therapists do is kind of like hold the hope for the patient, right? And you might, talk to parents about that. Can you, if your child is experiencing a sense of helplessness and hopelessness when they're feeling so intense, can you be there to kind of cheerlead them and hold the hope? All right. The other part, which is interesting, which Dr. Manning talks about, is like maybe cut yourself some slack as a parent and maybe self-validate. You might feel relief when your kid is inhibited grieving, right? So Alex's parents feel kind of relieved when he's in his room on his video games because he's not panicking. He's not he's not paralyzed. He's engaged with something. And if you can self-validate as a parent, say, okay, it makes sense that I feel that sense of relief, and be aware of that, it's going to put you in a much better position to then not just let that slide than if you're pretending, something else. Okay, and not validating yourself there. And again, encouraging your child to get the help that they need, in particular exposure therapy, if you can't get them to do some opposite action. Okay. Any questions before I keep going? Oh. So, you notice that a lot of these kind of boil down to pretty common components that we're pretty, used to trying to teach families. And I think it's important, right, to note that the validation, acceptance, and all that is going to be pivotal in how the parents do respond to their kids. But I think mapping it out in terms of dialectical dilemmas can be really helpful in getting the parents to understand what's going on so that they don't feel kind of like they're drowning in this chaos. Okay? And in that process, it's going to be really important to kind of tune into what's the style at home, what's the stance at home, the culture at home around distress and vulnerability. Getting one question. At some point, will you speak to how to map this out to the parents? Yes, that's the next thing we're going to do. Okay. So you want to get a sense of like, are the parents open to emotions? Are the parents expressing emotions? Are the parents okay with their kid being distressed? Do they really get it that in order to recover from whatever's going on, their kids are going to have to feel unhappy and angry and upset? And can they accept that? Right? How do the parents respond to the fact that their kids aren't perfect? So Kelly's parents actually are pretty distressed with an A minus. Is there wiggle room there? Is there a way to diffuse kind of that attachment to those grades? What comes up when you suggest that? Is it defensiveness? Do the parents show despair and sadness? Right? Because if they show defensiveness, that might suggest they're reinforcing that apparent competence and inhibited grieving because they're reinforcing their kid kind of shutting things down. If they're expressing kind of sadness and despair at this prospect, they might actually be fueling some of their kids' hopelessness and helplessness because they also don't believe the kid can do it, right? And teaching them some skills might be really helpful. Okay. So you're working really hard to help parents move towards acceptance, right? And identifying, okay, what is actually in your control here? What is out of your control? Can you actually control that your kid's going to experience pain in life, right? Can you control some of your kids' behaviors or not? And how can you accept that? And how can you accept are you doing some inhibited grieving by not accepting where your kid's at? Now, for the therapist, it's also really important to note that, the therapist might need to accept that the parents aren't ready to accept yet. And the parents might need to try to go into that, like, spinning their wheels with problem solving and reassurance and accommodation before they're ready to say, okay, I need to accept that this is not going to go the way I want it to go. And also be mindful of the parents' own limitations, like the psychiatric vulnerability. So are there psychiatric issues going on with the parents that are making it hard for them to actually not reinforce these cycles? And would you need to refer them for treatment? Andre, I think you had another question.
Yes, thank you. What would you say is the most effective way when trying to get parents to engage in the process here in the work, right? What's the most effective way to do that when there are very noticeable cultural barriers? For example, I've dealt with a ton of parents who, culturally it's just not acceptable, especially for young males to be emotional, things like that. I've even had families where culturally, having mental health concerns is also not acceptable. Therefore, they're very disengaged.
Yeah. Again, I think to some degree, this is just a piece of things, right? And there isn't going to be one answer that like addresses everything.
Of course.
I think that it's a dialectic. It's a balance between kind of meeting the parents where they're at, and you might need to accept that there might be a limit to how flexible they can get right now.
Yeah.
If you have access to the kid's therapist, if the kid is in treatment, or if you're working with the kid too, it might be about like helping the kid kind of individuate from parents a little and separate them. So it kind of, if you think of the DBTA dialectics of like fostering some independence there, and how can they self-validate enough to do that?
Right.
Validating the struggle there. And then with the parents, there might be a little bit, first of all, I think a ton of validation. especially if it's a cultural thing. Because that takes like a visceral hold on people, right? If they grow up in a certain culture and they have really strong beliefs, it's going to be very hard for them to really kind of get any space between that and their, be just like away from, like, take a step back, right? And so, but also talking with them about then what's workable here, right? It's like, is this workable? So you're wanting a relationship with your kid. Your kid is suffering. You might have to like ride with them a little, like, okay, we're going to do it your way for a bit. Okay, so like it doesn't seem to be working. Right? Like it's been like 2 months and your kid is still on the couch, not going to school, and now they're failing classes. And I know you love them and you're worried about them, and I'm worried about them too. And I'm worried that maybe, the approach that you're taking just might not be workable.
Gotcha. That makes sense. Right? I love especially the acceptance part on my part, just knowing that, okay, this might just be where they are, and I accept that. And I also love the validation piece. I think that's really powerful. That works wonders in so many cases. Yeah.
It can be hard to do, right? Especially when you see like, oh my God, just stop doing that. Like you start playing into that cycle, right? Yes. Like all of a sudden you're the parent and they're the kid. It can be really difficult.
So true. Thank you so much. Thank you.
Yeah. Right. So speak of validation, right? Ultimately, a lot of what we said, other than some of the change language around skills, is the validation component, right? And you're really helping parents. So again, I'm going to walk you through, like there was a request to do around how you walk parents through this. And I think you'll see that really clarifies things so that they're a bit more ready to validate and accept after you walk through the dialectical dilemmas and make sense of it with them. So you want to encourage them to lead with validation, even if they're setting limits, obviously, even if they are observing their own limits. It makes sense that you're feeling this way. It really sucks that you feel this way, and the other side. And again, that psychoed with parents, that, it might be very counterintuitive, but there's some evidence suggesting that validation actually de-escalates that emotion overwhelm, neurologically speaking. And so just validating people, I often give this example. I think I talked about this last time, is like when I was in college, I was living with my aunt and I was struggling with some depression and I had to go to work. I didn't want to go to work. I was like slumped on the couch like this. And all I said is like, I don't want to go to work. And she, with my head down, and she said, I know. Right. She didn't say, well, you need to go. Well, what can I do to help? She just said, I know. And literally my head felt lighter. Right. And my willingness went up. And that's an experience that I personally had, which really helps me kind of really believe in that power of validation. You want to really encourage observing your own limits. I see a distinction between observing limits and setting limits. So when you're trying to help parents observe their own limits, it's really not about maybe even what's good for the kid. And they might need to acknowledge that, like, I need to go, my kid might need to talk until 2 a.m. I need to go to sleep because otherwise I'm not going to be able to function. And that might disappoint my child and it might be very upsetting to them. And it might be totally valid. And I still need to take care of myself. And it models that it's okay to take care of yourself to the kid. And it also ultimately prevents burnout because, otherwise parents are giving and giving and giving. And eventually they get to a place where they just can't. And then they kind of swing to the other side of invalidating responses. Limit setting, I think, is a bit more about teaching skills and thinking about what your values are as a parent and what you want to impart on your child. Right. And so like by teaching them some opposite action and pushing them to do some opposite action when they're feeling so emotional, or helping them problem solve when they're so anxious about it, you're teaching them that it's okay to feel distress and act opposite and do what you value. Right. And I see a bit of a distinction between those two. All right. So how do we map this out? So I apologize if this isn't like perfectly like, PowerPoint smooth, but I couldn't think of another way to do this. So sometimes I'll put this on the board, I'll put it in a table. And so if you think about Alex for a second, so you might start, right? So you start with a column to the left, the child's behavior, and just describe the behavior. So, oh, there's a question. It's, oh no, print is too small. Oh. Okay, let's see if there's any way to problem solve that. Sorry about this, guys. Just hang on a second.
I think what we're saying is that it may be that person, they can go to full screen and then they'll see it. The print isn't too small. I don't think it's necessarily too small for everyone.
Okay, thank you.
You're welcome.
All right, well, can people like verbally say okay if they can see this?
Yeah, I can see it.
Can see it? Okay.
Yeah, I can see it too.
I can see
Awesome.
it.
Thank you. All right, so the left-hand column, child's behavior. So you want to just describe it. Okay, so Alex is curled up on the couch and he's having a panic attack. He's hyperventilating, he's crying. He's not asking for help. He's curled up on the couch.
Can you reshare the screen?
Yeah.
Oh, sorry. Thank you for letting me know, by the way. I appreciate it. All right, the better? Yes. By people's silence, I will take it that things are okay.
It's great.
Awesome. Thank you. Thank you so much also for speaking up. I really appreciate it. Okay, so describe the kid's behavior and then try to understand it. All right. So like if you have time to take a step back, go to the bathroom, splash some water in your face and think about, okay, what's communicated to me here? Okay, so he's communicating that he's overwhelmed. He's saying, I can't do it. I can't do it. I can't do it. All right. If someone's so overwhelmed, they're saying, I can't do it. Probably there's some emotion vulnerability being expressed here, right? The kid feels at the mercy of their anxiety. Okay. So what is my automatic response here? What do I want to do? What's my urge? My urge is like, oh my God, I feel horrible for him. He's a poor baby, like struggling with this wave of anxiety and panic. It must be terrible. I just have this urge to go to him, to hug him, to soothe him, to let him stay home, do what he can play on his computer, whatever he needs. I just want him to calm down. Okay, so we've observed all that. And then ask yourself, right? So you might tell the parent, okay, the next column you want to go to is like, so what would be the message to him if I did that? Right? So he might learn that he can't deal with his anxiety and that the only way to deal is to avoid, right? And that anxiety is too big. And then ask yourself, would this reinforce the extreme of a dialectical dilemma? So what would this reinforce? So the parent might say, okay, I guess it reinforces his avoidance, right? So it doesn't really incentivize him to go to school, to manage some of this anxiety in any shape or form. And it kind of teaches him he can't handle it. All right, so what might be an effective response? Okay, so first validate, right? So let him know that I'm here. He looks, he's in pain. When, you might take a couple different, but you might just say, when you're calmed down, if he's in therapy, for example, and he has some skills under his belt, you might offer some help and say, when you're calmed down, I'll be back. Or you might be more active here and validate, you look like you're suffering so much here. Why don't we practice some things that can help you calm down, right? Like, I know you learned to tip the other week. I happened to learn that in my parent group. Or what can you do that's just a little bit against some of this anxiety? So can you get in the car? You don't have to go to school. The opposite action is just to get in the car. Now you want to be careful though here that again, the parent doesn't go into overdrive and like, okay, let's do this and let's do this and let's do this, because that actually is probably going to increase the overwhelm. it's also going to burn the parent out. Right. So there's a bit of a kind of balance between like, okay, you can teach them, that you can gently probe them, but try not to nag them and push them and be the kind of the ultimate person who's leading here. Okay. In Kelly's example, right? So what's the behavior? Excuse me. So she's telling me everything's fine, but then I get a bill that she's in the partial hospital program. Like, what? So what might be driving this? Well, like maybe she's afraid. Maybe she's afraid of telling me. Maybe she's embarrassed, right? So when people hide something, that might indicate they're embarrassed, they're shame. They have shame going on. Where does this fall? So, well, you know, if they're acting one way in one context and another way in another context, chances are that's apparent competence, right? Okay, so what's your urge here to do? Well, it drives me crazy. I just want to yell at her and tell her to stop it. Like, just cut it out and stop telling others that there's problems. Clearly, there's no problems, right? So this is like something that happened. This is something the mom would say. Okay, so you've identified what you want to say, what you want to do. What message would this send your child? I guess it would send her the message she just needs to deal, right? And maybe the mom, you know, in this case, the mom went a bit on a diatribe of like, well, she just does need to deal. Like, this is life. Life is hard. Da, 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 da. And then you go to the workability. Okay, then what's the message here? What does it do? Getting another question. Could you use these worksheets with an older sibling who is struggling in their relationship with a younger sibling? Can you describe a little, Laura?
Yeah, I'm working with a client who brother recently had like a near suicide attempt, and I think that they're describing a lot of sort of frustration in terms of their interactions with the brother and kind of wanting to play fix it. The client is not really the younger brother's not really saying a whole lot, and this is really scary to the older sibling, to the client. And so I'm wondering if you would ever sort of do this worksheet to help them. I really like what you said about sort of like grounding them like in the chaos and like mapping things out. I just wonder if it would sort of help them connect the dots a little bit. Or would that be like parentifying the sibling?
Excuse me. I think it really depends. How old is the sibling?
About to turn 18, and the younger sibling is like 14, 15.
Yeah. I mean, I think it's dialectic, right? Like, you don't want to parentify them. And at the same time, if they're playing fix it and they're 18, I mean, they might be in a place where you could have a talk with them about, okay, so like, what are you actually teaching your sibling that you care so much about? You're playing fix it. Again, that workability, like, is it working? Is it actually helping your sibling? Is it actually doing what you want it to do? It can actually be a really good opportunity too, to just in relationships in general, right? Because we do this with friends too, and to some degree, right? If I have a friend, I'll speak for myself, who like struggles with a lot of things, I might need to kind of think about how my responses are affecting them and myself. And it might be actually a really good opportunity to teach them to reflect on that if they can kind of grasp it intellectually. I don't see why not.
Yeah. Thank you.
I haven't tried it. But, so I forget where we were. Okay, so the mom is like really kind of like, you know, she does need to suck it up. Okay, so we have like, we're not judging, we're just kind of mapping out where things are at. And then, all right, so what would you be reinforcing here? You know, if you buy into my theory that all this is going on and it's fueling dysregulation, well, I guess if I yell at her, she's not going to want to tell me stuff, right? She can kind of acknowledge that. Okay, so then what's an alternative? So you might, even though it's really kind of grates at you, you don't feel good about it, let's just practice ways to validate her, right? And be curious, because that's going to increase the likelihood that she'll talk about the distress when it comes up and give you a chance to teach her to manage it when it comes up, as opposed to it being so indirect and so confusing to all of you. Okay. So I wanted to give an example of something I think we all really kind of come up against, and something that I struggle with. I don't know that this is the answer, because I think it's always really tricky and difficult. But when a kid makes a suicide threat to a parent, right, or a threat to self-harm, that can be pretty paralyzing, right? So like, how do they react? Because what if it's true? What if they might do something to hurt themselves? And slowing this process down a little, as opposed to being reactive, can be really important. And so again, you go through these steps, right? So like, okay, so if you make me go to school, I'm going to kill myself. All right, what is Alex communicating here? Well, he's communicating he feels helpless, he's overwhelmed, he's in pain. Okay. What might that be? Emotional vulnerability. It might be some active passivity, right? There's a problem, I'm not going to fix it, it's your problem kind of a message. Honestly, my urge as a parent is to just let him do what he wants. I don't want him to kill himself, right? So what's the message you're teaching your kid here, if that's what you do? I guess maybe the message is, well, if suicide comes up, then you don't have to deal with stuff, right? So if if there's an urge to attempt suicide, then that means I just do whatever feels good. Does it reinforce an extreme on the dialectical dilemma kind of continuum? Well, yeah, right. It doesn't really give him an alternative or alternate ways to manage distress. Here, I think it's really important to kind of get a sense of whether the kid is in therapy or not. If the kid is in therapy, right, you might validate their distress. So that second column is super important, because now you've figured out what they're trying to communicate. You want to validate that, and then suggest they reach out to their therapist, right? You might want to validate, be a bit more curious. By validating, you're de-escalating things so that you can get a bit more information on what's going on. And if you have a plan with the team already in place, follow that plan, right? So if the therapist, your kid has a therapist, the therapist has a clear conceptualization of what's going on, you might, reach out to the therapist, although I wouldn't usually suggest that, depending on the intensity of things, but you might have a cope ahead plan already in place with the treatment team. If the kid is not in therapy, that gets really, really tricky, right? Because it's really hard to tell parents, just don't reinforce that, because especially if you're just doing parent guidance and you haven't really met the kid, maybe you met them once or twice, but you don't know them really well. It's very kind of like uncertain, right? And so you might help the parents again validate, to kind of try to reduce the overwhelm, ask some curious questions to try to assess what's going on, see if the kid is open to kind of making some sort of plan. And maybe by even just having a conversation, some of the SI might have kind of subsided a little. And if needed, like really, really encourage parents, if you're worried, if you're scared, go to the ER, call the emergency services. If the kid is not in treatment, you really don't, I guess I won't speak for others. I don't feel comfortable having the parents play kind of like therapist there. And so if the kid is not committed to treatment and they're talking about suicide, I will pretty quickly suggest that the parents get them evaluated. Now it might depend on whether this is a pattern that's happened, right? That might change things a little bit. But helping the parents make use of the resources around them, like talking with the school, trying to get a sense of what's going on at school, so that you're getting other people's perspectives who have contact with the kid as well. Let me just see what time it is. All right, so I wanted to kind of walk through the examples that you guys bring out, but I don't think we have time for that. But I will ask if there are any last minute questions, Paul. No? Okay. So one last word that I'll say is that a lot of this is principle based, right? So these are not, I didn't do a study on these, on this intervention, or on these worksheets and how they, what the outcomes they produce. If anyone is interested in collaborating on research around this, I would be super interested in doing that. It is all principle based. So it's all based on principles that have been scientifically studied. Although it's not firsthand research on my end. Okay. If you do want CE credits from this talk, you will be, there will be an evaluation sent out. If you can, even if you don't want CEs, if you could complete the first part of that evaluation, just so we get some feedback from you of how this went, what you think, that would be awesome. And if you do want CEs, you do need to complete the whole evaluation and attestation that you attended the full talk. Okay. The recording will be available on our website in the next few days and for at least a certain amount of time if you want to rewatch it. And it'll be free of charge. Okay. I really appreciate everyone attending. Thank you so much. I hope you have a great holiday season.
Thank you.
Olivia, I had
Thank
one
you.
question. I don't know if you saw it in the chat.
Oh, I didn't. What was it?
About, do you do a separate group for parents and a separate group for adolescents, or do you do the multifamily skills groups?
I have done them separately, but I actually would suggest doing the multifamily groups. I think the research suggests that that's really powerful. That's what most of the studies have been based on. Sometimes I have had parents talk about how like sometimes the groups will like be together for the teaching part, but for sharing of homework, they might get separated so that the parents can talk a bit more about the conflicts that come up for them. So I've heard parents say that that's been helpful. So I've done it both ways, honestly.
So when you
go ahead.
So when you're doing going over this chart with parents, this is more in parent coaching or individual meetings with parents?
Yeah, this is individual meetings with parents. Yep.
Okay. Thank you. This was wonderful. Thank you so much.
Thank you. Have a great holiday season, everyone, and a happy new year. Take care.